You had your blood work done. Your doctor looked at it and said, everything looks fine. Your liver enzymes are normal, nothing to worry about. But here is what most doctors don't tell you. Up to 80% of people with fatty liver disease have completely normal liver enzymes on a standard blood test. Even people with advanced scoring. And right now, roughly 1 in 3 adults worldwide has fat buildup inside their liver without knowing it. So if you're waiting for your blood work to warn you, you're waiting for the wrong signal. In the next few minutes, I'm going to show you 5 signs your liver is already under stress. Signs that show up in your energy, your body, your digestion, and even your thinking, long before any blood test turns abnormal. I'm a board certified gastroenterologist and liver specialist. I see this every single week in my clinic. By the end of this video, you will know exactly what to look for and what to do next. Your liver does over 500 jobs every day. It filters your blood, produces bile to digest fat, regulates your blood sugar, and processes every medication you take. It works every minute of your life, and it does all of it silently. The liver has almost no pain receptors. It cannot send you a sharp pain to get your attention. By the time most people feel something is wrong, the damage has been building for years. Most cases of advanced liver disease are diagnosed only when someone arrives at a hospital with a serious complication. That is how silent this disease is. Fatty liver disease, now officially called MASLD or metabolic dysfunction associated steatotic liver disease, is the most common chronic liver disease in the world. It affects an estimated 1.3 billion people. It is not caused by alcohol. It is driven by what we eat, how much we move, and how our metabolism is functioning. The 5 signs I am about to show you are the early warning system your liver does have. Pay attention to them. Sign number 1. Fatigue that sleep does not fix it. This is the most common thing my patients describe. Almost none of them connect it to their liver. You sleep 8 hours, you wake up tired, you drag through the morning. By the afternoon, you are already exhausted. You have already checked your thyroid, you have already checked your iron levels, everything came back normal, your hemoglobin is normal, but the fatigue stays. The research on this is clear. Patients with fatty liver disease report significant fatigue at roughly 3 times the rate of healthy people. And here is what makes it easy to miss. The fatigue does not always reflect how advanced the liver disease is. Someone with early fatty liver can feel just as exhausted as someone with further along. The reasons are layered: chronic low-grade inflammation from the liver, disrupted communication between the gut and the liver, impaired energy metabolism in the cells. It is not one broken switch. It is a whole metabolic system under sustained strain. If you have been tired for months or years with no clear explanation, your liver deserves to be part of that conversation. Sign number 2, belly fat that will not change or move. This one surprises a lot of people. Most people know that excess belly fat can cause fatty liver. What they don't know is that it works in both directions. Fatty liver makes it significantly harder to lose abdominal fat, and that creates a cycle that is very hard to break. When your liver is fatty and inflamed, it becomes insulin resistant. That insulin resistance signals your body to store more fat, specifically the deep abdominal fat that surrounds your organ, visceral fat. Your liver also ramps up a process called de novo lipogenesis, that is essentially manufacturing new fat from the sugar you eat. So if you're eating carefully, exercising consistently, and your waist will not change, especially if the weight is sitting around your abdomen, your liver may be the reason your efforts are not producing any results. This is not a willpower problem, it is a metabolic problem. And it has a solution. But the solution has to address the liver, not just the calories. Sign number 3, bloating after meals, especially in the afternoon. Your stomach is flat in the morning. By early afternoon, you're swollen and uncomfortable. Every day, you blame what you ate or how fast you ate or some food intolerance. Sometimes those things matter, but in many cases, the liver is contributing. Your liver produces bile. Bile breaks down dietary fat in your small intestine. When the liver is fatty, the composition of that bile changes. The balance of bile acids shifts in a way that disrupts fat digestion and alters the gut microbiome. When fat is not digested efficiently, bacteria in your colon ferment it and produce gas. That gas is your afternoon bloating. Research has also shown that about a quarter of fatty liver patients report chronic loose stool, and meaningful subset have features of bile acid diarrhea. The gut and the liver are in constant two-way communication. When the liver is struggling, the gut almost always reacts. If you bloat predictably after meals and no one has given you a satisfying answer for why, your liver is worth investigating. Sign number 4, brain fog. This one is almost never discussed in the context of fatty liver, but the research is becoming very clear. Trouble concentrating, mental slowness, forgetting the word you wanted mid-sentence, feeling like you're thinking through thick glass. These are documented findings in fatty liver disease, even before any serious liver damage has occurred. The most rigorous data on this comes from work on the liver-brain axis. Patients with MASLD can have a measurable deficits in attention, memory, and processing speed even without cirrhosis. The mechanisms involve systemic inflammation, disrupted blood regulation, changes in gut-brain-liver communication network. This is different from the severe confusion seen in advanced cirrhosis. In early fatty liver disease, the cognitive symptoms are subtler, but they're real, they're measurable, and they're usually missed. If your brain fog has no clear explanation and shows up alongside fatigue, your liver belongs on that list. Sign number 5, your metabolic profile. This last sign is not something you feel, it is something you can measure, and it is the most actionable one on this list. Fatty liver does not develop in isolation. It develops in the context of metabolic dysfunction, and your body shows you that dysfunction in every specific ways. Your waist circumference, above 40 inches for men and above 35 inches for women, significantly raises your risk. For South Asians, the cutoffs are even lower, 35 inches for men and 31 for women. Your blood sugar, about 60% of fatty liver patients have either pre-diabetes or type 2 diabetes. If your fasting glucose is above 100, or if your hemoglobin A1C is above 5.7, your liver is very likely accumulating fat. Your triglycerides and HDL, high triglycerides paired with low HDL, that exact pattern is present in 60 to 70% of fatty liver patients. It is not only a heart risk, it is a liver risk. And one visible skin sign worth knowing, acanthosis nigricans, dark velvety patches on the neck, armpits and groin. They look like dirt that will not wash away. They are markers of insulin resistance, which is the core driver of fatty liver. If you see them on yourself, your liver may already be affected even if you feel completely normal. None of these alone is a diagnosis, but 2 or 3 together, central weight, abnormal blood sugar, abnormal lipids, is the exact metabolic profile that drives fatty liver in the vast majority of patients. So let's bring this together. Fatigue that sleep cannot fix, belly fat that will not move or decrease, bloating after meals, brain fog that has become your normal, and a metabolic profile that is quietly telling you something is wrong. Any combination of these, especially alongside a family history of diabetes, high triglycerides or pre-diabetes, means your liver needs a proper evaluation, not just a standard enzyme test. Ask your doctor about a liver ultrasound, and also ask about your FIB-4 score. It is a simple calculation using your 4 numbers already in your routine blood tests. Your age, your AST, your ALT, and your platelet count. A score below 1.3 is low risk. Between 1.3 and 2.67 means you need further testing. Above 2.67 means you need to see a specialist. I will dedicate a full video to exactly how to calculate and interpret that number. The most important thing I can tell you right now, fatty liver is largely reversible in its early stages. Clinical trials show that losing 10% of your body weight can resolve the inflammatory form of fatty liver in up to 90% of patients. The window to act is open, but you need to know the window exists. If this video helped you understand something about your own body that you had not considered before, share it with someone you love. Most people living with these symptoms have never once heard their liver mentioned. They deserve to know. Subscribe to this channel. Every week I explain the real connections between your liver, your metabolism, and your everyday symptoms based on evidence, not trends. In the next video, I am going to show you why your so-called normal liver blood test may be giving you a false sense of security and what those numbers actually mean. That video could change how you look at your health results forever. I will see you there. Thank you.